I'm Vivek Reddy from Mount Sinai Hospital in New York City, and I'm going to be speaking on the Manifest PF Registry one-year results. Well, if you look at the current data with the Pentaspline catheter, we're really looking at the first-in-human trials that were performed about 2+ years ago. And there the data was quite good. We have excellent durability data and excellent one-year outcome data. With the paroxysmal population in which it was tested, the outcomes were about 83% success at 1 year. With persistent patients, we do have some data, but really in a very small number of patients. So now fast forward to 2-3 years later, now the Pentaspline PFA catheter has approval, it has CE mark approval here in Europe, and is now being used in clinical practice. So the purpose of the Manifest PF registry was to try to understand how it's being used in practice and what are the outcomes in practice. We had previously had a Manifest PF survey. We published that about a year ago. That was really a center-level survey that was really focused on safety events and acute procedural success. We had no data on long-term procedural success, and we didn't have patient-level data. So we went back to the first 24 centers that started doing pulse field ablation. We asked for information on the first group of patients that they treated after the device was approved in 2021. And overall, it was 24 centers, everybody participated, so 100% participation. We included just over 1,500 patients who underwent a first-time ablation for either paroxysmal or persistent AFib. It was about 2/3 paroxysmal, 1/3 persistent. So a lot of patients, a lot of centers, a lot of operators. The Manifest PF registry was designed as a retrospective analysis of, at many centers, prospectively collected cohort of patients. It was a patient-level analysis, so we had individual patient-level data. And we wanted to understand the one-year outcomes in clinical practice. So the primary endpoint for our study was looking at freedom from any atrial arrhythmia recurrence with a 3-month blanking period, so 1-year time horizon. We had a secondary outcome of freedom from arrhythmia or also freedom from taking an antiarrhythmic drug or undergoing a redo ablation procedure. That was our secondary endpoint. So we got the information from all of the centers, and then we combined the data and then just recently presented the data. If we look at the patient population enrolled in Manifest PF, it was about 2/3 of the patients were paroxysmal AFib, 1/3 were persistent. Very few long-standing persistent patients. It's sort of, I think, the kind of patients that are typically treated in clinical practice. About 40% of the patients were receiving a Class 1 or a Class 3 antiarrhythmic drug before entering the trial. The remaining were receiving beta blockers or calcium channel blockers. The ejection fraction was largely preserved in this population with relatively few heart failure patients. So let's talk about the key findings in Manifest. So the patients were followed for a median of 367 days, so about a 1-year follow-up. And what we saw for the primary endpoint, freedom from atrial arrhythmia recurrence, in the full cohort was a success rate of 78%. If we separate it by AF subtypes, the success rate was 82% in the paroxysmal population and 71% in the persistent population. If we look at the secondary endpoint of freedom from arrhythmia or redo procedure or antiarrhythmic drug, the success rate dropped a little bit in the cohort to about 72-73%. We also did some analyses to try to understand what predicted success versus failure in terms of centers. We did analysis looking at centers that did a lot of procedures versus few procedures, and basically there was no difference in outcomes. And one thing that says is that using this catheter, people have pretty good outcomes pretty much the first time they used it. Now I should note, these are 24 experienced centers, so these are not novice centers. But the point is, with an experienced center introducing this catheter for literally the first time that they've ever used it, they're having good outcomes. On the safety side, what we saw was, just as we saw in the previous survey, there were no esophageal complications, no evidence of PV stenosis, and phrenic nerve palsy happened in literally 1 in 1,000 patients, actually less than 1 in 1,000. And we saw no other unusual side effects. So overall safety continued to look good. When we think about what's unknown about PFA, I think that Manifest really helped in trying to understand what is the efficacy in sort of clinical practice. I think that's very important. But there are other questions on the efficacy side. For example, what if we have an implantable loop recorder and we're looking at short bursts or asymptomatic AFib that may not otherwise be detected in clinical practice? Will that track just as we see, for example, with thermal ablation? My guess is yes, but we don't have that data, and we need to assess that. On the safety side, look, this is over 1,000 patients, over 1,500 patients, and the safety looks excellent. Of course, I'll feel even more comfortable after 10,000 patients to continue to see, number one, that these sort of complications that we're looking for continue to be either not happening or extremely rare. And number two, there's always the possibility of the unknown, the complication we've never even thought about that may potentially occur after 10,000 patients. Again, it seems less likely, but it's something that we should need to continue to watch for. Now, following up the Manifest PF registry, there are a couple of analyses that we've already had planned. It is interesting, for example, to try to think about how different populations fare with pulse field ablation. For example, there's been some data that women, for example, may not do as well with catheter ablation of atrial fibrillation as men do. There's other data suggesting that that may not be the case. I think it's very important for us to understand how different genders, I think it's very important for us to understand what the effect of pulse field is on different genders. So that's an analysis that we're planning. We're also planning on looking at the redo patients and trying to better understand why failures occur. And then following up Manifest, we are thinking about not a different analysis, more based on a safety analysis at even larger numbers of patients. But again, this is in the planning stages.